What is monkeypox? Amazing facts about the viral disease. What is monkeypox? If you've never heard of monkeypox, you're not alone. This viral disease has mostly affected people in African countries in the past. However, there have been cases of monkeypox reported in the United States, including one in Texas. This video will explain what monkeypox is and how to spot it, so you can understand more about this disease and how to stay safe from it. Don't forget to subscribe to the Factual channel, where we post about the latest stories and some crazy facts as well. Number 1. Overview. Most of us have heard of SARS and smallpox, but not too many people have ever heard of monkeypox. Maybe you've even said, "What is monkeypox?" before you read on. Well, don't worry. We are here to tell you all about what monkeypox is and how it affects humans. But before we get to that, let's talk about where monkeypox comes from. Monkeypox is a viral disease that can be transferred between animals and humans through contact with infected animals or their bodily fluids. The virus was first discovered in 1958 when scientists isolated a strain of smallpox virus in African monkeys imported to Belgium for research purposes. It was then named monkeypox because they were able to isolate similar strains in other species as well, including chimpanzees, vervet monkeys, baboons, squirrel monkeys, and African green monkeys. Although there have been no reported cases since 1978, when an outbreak occurred in Zaire, experts believe that human-to-human transmission could still occur today if proper precautions aren't taken during laboratory work involving animals infected with monkeypox. Number 2. Transmission. Monkeypox is primarily transmitted to humans by contact with fluids from infected wild or domestic non-human primates or their body secretions. Humans can be exposed to these viruses through broken skin or mucous membranes, such as mouth, nose, and eyes, while handling ill or dead animals. Because individuals in close contact with ill persons are at high risk of contracting monkeypox, it's possible for transmission to occur from human to human. But there have been no documented cases of person-to-person transmission of monkeypox. It's also not known how long a person might remain infectious after being exposed to the virus. However, it appears that most people who become ill develop symptoms within 8 to 10 days after exposure. The incubation period, the time between exposure and the onset of symptoms, is usually 12 to 14 days, but may range from 6 to 21 days. Number 3. Symptoms. The early symptoms of monkeypox include high fever, headache, muscle aches, nausea, and fatigue. Because there is no specific treatment for monkeypox, some experts recommend bed rest, maintaining hydration, and taking acetaminophen to control fever. As symptoms worsen and begin to spread throughout your body, red spots will appear on your skin that later develop into sores. These sores can form blisters in extreme cases. Other symptoms include swollen lymph nodes, mouth ulcers, and eye inflammation. In rare instances, a person infected with monkeypox might also experience encephalitis or meningitis. In these cases, it's important to seek medical attention immediately, as both conditions are potentially fatal if left untreated. If you're finding this information interesting so far, kindly subscribe to our channel, Factual. Number 4. Diagnosis. For an accurate diagnosis, healthcare providers will take a detailed medical history and conduct a physical examination. A blood test may also be ordered to help identify monkeypox. However, because of its similarities to smallpox, doctors are likely to suspect that it is smallpox if they see a rash in someone who has recently traveled from West Africa, or if they see an unexplained rash in someone who has been exposed to infected animals. In these cases, samples would be sent for testing immediately. If it's not suspected that you have smallpox, your doctor might send samples for testing up to 10 days after you first notice symptoms. The CDC says that there are no routine tests for monkeypox, but some labs can do special tests on skin samples or blood tests that can confirm whether or not you have it. It's important to note that these special tests aren't available at all locations and might take several weeks before results are available. Number 5. Prognosis. Fortunately, for most patients, a monkeypox infection is mild to moderate. A person who contracts it may experience fever, rash, tiredness, and swollen lymph nodes. The disease can be serious for people with weak immune systems or those whose symptoms are severe enough to require hospitalization. In these cases, there's a 30% chance of death. If you suspect that you have contracted monkeypox, it's important that you seek medical attention as soon as possible. Most cases of monkeypox can be treated at home, but if left untreated, it could become fatal. Number 6. Prevention. There are steps you can take to reduce your risk of catching or spreading monkeypox. First, educate yourself about its transmission and symptoms. Second, be sure to wash your hands frequently. You'll want to do it with soap and water for at least 20 seconds after handling potentially contaminated items. That includes laundry. It's also a good idea to avoid contact with rodents, since they're known carriers of some diseases. Finally, if you live in an area where monkeypox is common, consider getting vaccinated against it. The Centers for Disease Control and Prevention recommends doing so if you live in an area where there has been a confirmed case of human infection within 10 days prior to vaccination. Vaccination is especially important if you work with animals that could carry the virus or spend time in areas where there are outbreaks of animal-to-human infections. These vaccines aren't available everywhere, though. Check with your doctor before getting one if you don't know whether it's available near you. Number 7. Treatments available. There are a few treatments available for monkeypox, but each is subject to change as research continues. Currently, patients can be treated with ZMapp, which is only approved for use on humans and not monkeys. As of now, there are no U.S. Food and Drug Administration (FDA) approved drugs for treatment of monkeypox. However, that doesn't mean they don't exist. It's just that they haven't received official approval. Number 8. Previous outbreaks and cases reported worldwide. In addition to Africa, outbreaks of monkeypox have been reported in various parts of Central and Western Africa. The first reported outbreak was in the late 1970s, following a shipment of monkeys from Ghana to Germany that were subsequently sold as pets. Outbreaks have also been reported in 1994 through 1995, when a troop of rhesus macaws escaped from a facility in Chicago. The virus is believed to have spread through handling and contact with infected animals. Conclusion. So, once infected, your immune system will eventually clear out any remaining traces of monkeypox. But in some cases, it may take several weeks before you're back to normal again. That's the end of the video here on Factual. See you in the next video, and thanks. Kindly share the video with your friends and family, and hit the subscribe button as well.